Welcome back. It's Taurus. Show my not so handsome, possibly handsome face. Welcome back. More teaching with the GlideScope T3 Mac blade. Okay. Another advantage of this product, of this blade that looks like a Mac blade, but connects to a GlideScope monitor, is this. I no longer have to use this stylet that has this weird angle. It's not straight to cuff. It's like a weird looking. Not even a hockey. It's almost like a, I don't know, field hockey stick. But I can use it. I also have the option of using an ET tube straight to cuff. Why? Because the blade is a Mac blade. Almost like a 3.5 blade. Okay? I'm going to show you some tricks, some cues on what not to do with the GlideScope. Okay? So I'm not watching the monitor. I'll be watching the patient's airway like I intubate regularly. Okay? Medicines are in, patient's been pre-oxygenated, I took off the face mask or stopped BVMing, bagging them up. I'm going to enter, just like I enter always with my Mac blade. Even in the GlideScope version, from the side, away from the chest. I'm going to deal with manned prominent chests from a man or a woman. I enter. I show my uvula. I'm currently doing ECM, blessing the forehead. Okay. Realizing, do I have an epiglottis view? Do I view the epiglottis? If I do, and I realize a curved blade, I have to go into vallecula. So I grab it as far as I can using ECM, bring the blade in as far as I can, and then I use some ECM. And when I see the cords, I'll proceed in intubating. From this side, angling towards the cords, entering. Now, you can try to do the capnometry to confirm placement, but I know it went in. Everyone saw it go in. Okay? Use the Easy Cap or Anti-Idle CO2 to tell everyone else who didn't watch the little movie that we just made that I got it in. Okay? Now, I try to minimize using my hands, rocking my hands as much as possible. But notice what happens when you actually use the monitor. So this time, you won't be getting a view. I will. But notice my hands. So when you don't look at your hands and only look at the monitor, you get distracted. You don't pay attention to the patient's face. Okay? When you don't pay attention to the patient's face, you hurt patients. Okay? So this product is a great device, but becomes a weapon. All right? You bruise lips, break teeth. Almost as if you're inducing a cleft lip on this patient, which is not fair. Okay? Even if I use the Mac blade that's connected to a GlideScope, I can still use this tube again. To reiterate, I'm using a regular ET tube with a regular stylet. Okay? Now I'm going to show you what happens when you pay attention to the monitor and don't pay attention to the patient. So some people are going to go based on the monitor, based on what the GlideScope video said, and they're going to enter midline. And they're going to lift. Okay? Some people just don't lift. Some people rock. Okay? They get a better view, but now the teeth that were loose already from bad dentition and dental hygiene will break. Person's on Coumadin, Plavix, or aspirin, or some medicine that has no antidote or a questionable antidote, he will bleed from that bruised lip or the cut lip. Okay? So I'm going to focus on the monitor and not focus on my hands. Something I almost never do. So I'm going to do this. The patient's head rocks and gets tilted in ways that I don't want to. Okay? Because I'm not watching my hands carefully. You almost have to simultaneously look at your hands and look at the monitor. Okay? I have a great view. I'm actually sacrificing technique to get a great view. I don't want that. Right? I want to barely move the patient's teeth and break. I do not want to break them. I don't want to cause new trauma. See the cords? I visualized. You didn't visualize that. Okay? So then I have to prove to you that it's in. Okay? I have to inflate the syringe and bag up this patient. For the purpose of the mannequin's chest rise, I'm using 2 hands. Ordinarily 1 hand. Okay? Stay tuned for more videos.